I mean, people say if you are a Māori male with a disability or a mental health condition, your life expectancy is 25 years lower than if you are a general population living on the North Shore. And you would think in a country this size, to have such a stark difference in life expectancy would be something that we would all be incredibly concerned and want to proactively do something about. This situation's been systemic. While life expectancy has increased for everybody, a gap still remains. It might have narrowed, but we're now into a different conversation, which is not just about life expectancy, it's about healthy life expectancy. So it's really hard to fathom for some people who have poor health that might not kill them, but low resources, how they will want to survive through living longer if actually their health is still not that great.
I think the first thing is to understand that inequities exist. We are lucky in a way in the health sector that we're able to get information quite quickly that shows us the state of things and shows us where we have certain population groups led by Māori who are not doing well. So I think that's the first thing we can do, is understand and own that equity exists. Secondly, I think it's to look at our own practice, to say, can we do better? Are we fairly treating all the people that come through our doors? Are we equally understanding of all the different cultural perspectives, aspirations that come through our door when we're providing services? Are there things we can do better? Challenging ourselves to understand that more of the same mightn't necessarily do anybody better, particularly those who are worse off. But I think it does start with understanding what equity is and how it exists. And then from my perspective, it's about getting personal about it. I take the view that, I work in Māori Health and Māori Health improvement because I have a personal commitment to improve the socio-economic circumstances of my people, and in doing that, contribute to New Zealand. I don't see them as mutually exclusive. And so when I'm working, I take my upbringing, my sense of community, the values that were instilled in me, and I take them into my workplace. And for me, that's what I need to do with equity. I need to take it personally and take on board a personal commitment, because achieving equity will be an accumulation of a whole lot of small things that people do. And so each of us can contribute to achieving equity by doing the things we do better, by being open to look at new ways of doing things, and sometimes by challenging our own preconceptions about how things should work, and being open to getting advice from people about different ways of looking at things.
The thing that I think is really good about the equity definition is it is explicit about unjust and unfair. And I think for the health system and for New Zealand in general, the sooner I suppose that we accept and then act on the unjust and unfair part of our definition, we've always known for a long time it's been avoidable. We've always known for a long time that we need to do something about it. But the real moral imperative, I think, of the area of both just and fair is something that New Zealand and the health system should really hold on to, because I think as New Zealanders we consider ourselves to be both a just and fair society.
My role, along with the Māori Health Directorate, is to help set the agenda for action around the Ministry achieving its goals, but I don't own those goals. Achieving equity belongs to everybody in the Ministry, as it belongs to everybody in our sector. It's not for me to own, it's for all of us to own and deliver on. So my role is to help shape some of the thinking. My role is to help provide some of the foundations for their thinking, and then to work with others in the Ministry to help them achieve it. At the end of the day, they're the ones who know their business, they're the ones who know their responsibilities better than I do. What we now have to do is put an equity lens across that to say, are we doing the best we can do? Have we looked to see if what we're trying to put in place is in fact going to cause existing inequities to get worse? What are we actually doing to address inequities? Because one thing we do know, you do not address inequities indirectly, you must address them directly.